This episode of the Folding Towels podcast is brought to you by Hygiene Australia. Did you know that oil retention in towels isn't just gross but can be a fire hazard? Hygiene Australia have worked with the health and wellness industry to develop cleaners and laundry products that are guaranteed to remove oil residues from your towels so that they feel and smell clean, last longer and reduce your risk of laundry fires. Listeners can get 15% off their next order when they visit hygieneaustralia.com.au and use the code 15OFF-FOLDING-TOWELS.
Hello and welcome back to another episode of the Folding Towels podcast. Hello, David.
Hey, Jackie. Who's sitting next to you today?
We have another special guest. It is the wonderful Rafael Bucater here, and a lot of Adelaide peeps will know Rafa. How you going?
Hi, guys. Thanks for having me.
So for those of you that don't know Rafael, he is a specialist in musculoskeletal therapy, deep tissue, remedial massage, and postural and biomechanical assessment. Raf has a bachelor's degree in physical education, a postgraduate degree in exercise physiology from overseas, a diploma in fitness, sports, and remedial massage here in Australia. That's really a lot.
That's a lot of letters.
Yeah, I really had to keep studying to keep my student visa for the country to allow me to stay, for the government to allow me to stay in the country. So I had to do some diplomas.
So you're also the ATMS 2022 Practitioner of the Year. Is that right?
One of the top four, so one of the finalists.
Wow.
Yeah, I was really pleased with that.
Yeah, that's really awesome. And I know you were bragging to me about this. You were also ambassador for Natural Medicine Week, which was late last year.
They had every year ATMS, they do the Natural Medicine Week. So it was last year, this year, my second time. And they're going to be running between the 20 to 26th of May with a few different events and stuff online.
But another exciting thing, Raf, is that one of your students was Student of the Year last year.
Yeah, so one of my students at AF Adelaide, Deb sent, shout out to her. She actually was one of the finalists as well for the Student of the Year. So really pleased with that too.
We're going to come straight off the bat with the question that we ask all of our guests. Who is your favorite superhero and why?
Dave, I knew that you come up with the question, so I had to do some homework on it. So I have to admit, I'm not really a fan of superheroes, but I was doing some homework here and found a Brazilian superhero. So that's where I'm from. So he's called Sunspot. So he actually can observe the solar energy to his body and use that for his powers, his strength, fight, and even energy discharge.
That is a pretty cool set of skills.
Yeah. I would like to give a shout out to all my friends, migrants, because I know it's really hard to leave your family and friends behind and embark in a new journey, learning a new language. And for those ones that English is the first language, if I could just have it, or empathy. I know that sometimes it's really hard to understand us because of a thick accent. But I really like that quote that says that if someone's speaking with a foreign or a thick accent, they are smart enough to know 2 or 3 languages. And most importantly, they are really brave enough to do their job in their second language.
That's so true. If you're in a majority English-speaking country like Australia and you have come here as a migrant, you probably know 2 or 3 languages, which personally, I'm a huge fan of linguistics. So I'm always in complete admiration of anyone that's learned a second or a third language.
I have tried learning another language and I could feel the language center activating and I was exhausted at the end of every single lesson. But yes, shout out to anyone who can speak multiple languages.
It can be really hard to learn a second language, but such a great skill, even if you only know a few words.
But I guess it forms a theme for today because in our pre-briefing with you, Raf, you've talked about how you're learning English as a second language, but having a Latin background has set you up really well for teaching anatomy.
Yeah, so I guess having to go through that trouble of learning English when I first came, just giving me some I guess strategies or methodologies to deliver some of those anatomy sessions. So I do understand that when we learning as a student, we're learning muscles or insertions, for instance, it is like learning another language. In matter of fact, it is Latin. So, and then I'll try to break it down, use some of those strategies to pass it on those informations to my students and even to some of other therapists that asking me to help them with some of the muscle knowledge. So yeah, just come up with a few different ways and understanding that how difficult that can be. Just come up with a few different strategies that we can breaking down the system and work slowly to make sure we acquire the knowledge.
So before we go any further, do you have a favorite muscle, Raf?
I sometimes my clients call me massage terrorist. So I quite like to work in some of those sole muscles. So I would say some of my top 3 muscles, or not muscles, the areas that we release. So I would say subscapularis probably it's one of my favorite one.
I like saying that one. That's a good one. Can I tell you what mine is, David?
Sure.
It's quadratus lumborum. Do you know why?
Because it sounds like Harry Potter.
It does. Every time I say that, I usually abbreviate it to QL, but every time I say that, I'm just waving my wand in my head going quadratus lumborum.
You can't just say quadratus lumborum either. You've got to say quadratus lumborum.
It's Leviosa. Do you have a favorite, David?
I quite enjoy saying thoracolumbar fascia, but I think my favorite anatomical landmark is the acetabulum, or as my anatomy lecturer used to call it, the archetabulum.
What is that?
It's where the head of the femur joins into the pelvis.
Okay, because everybody would know that.
Yeah, it's the vinegar jar.
I'm probably going to fail the anatomy test that we're having after this. So
Yeah.
sorry, folks.
But it's my favorite. So when clients point to their bum and call it their hip flexor, or they miss the name of something by that much, and they say, "Can you help me with my labial tear?"
My cervix hurts.
Yeah, that's right.
That's not in your neck.
Anatomically, it's the same origin of the word.
Oh dear. So Raf, you're actually lecturing at the moment at the Australian Institute of Fitness here in Adelaide, and you have been lecturing for almost 10 years.
Yeah, so 10 years coming close to 10 years now. So I'm just thinking, I was trying to do a quick math, how many students I have thought over those years, and probably how many of those are listening to us now.
There's definitely quite a few. I know there's a few because we've had so many students, not only from Adelaide, but all around, message us. It's the students that are messaging us saying, wow, awesome podcast. Just a little plug there. Sorry, guys.
And I have to share to say that I really share that with my students as well, because as I mentioned before, I think one of the comments on the socials, sometimes the students need to listen or hear from someone else instead of just the lecturers, And if they hear someone, they say, "Oh, actually, what the lecturer is saying, actually, it makes sense."
That's right. We're the cool auntie and uncle, David, and Raf's the not so cool parent.
We'll try not to lead your students astray.
We love you guys. Both David and I have been to a few massages last year in the student clinic at AIF at the Adelaide campus here, and they were great. Your students were really amazing. It was really good.
That's really good to hear.
Some massage therapists are anatomy nerds, and others really struggle to learn their landmarks, their muscle names, because if our listeners haven't noticed, much of anatomy isn't in English. It's using, as you've already said, Raf, Latin and sometimes Greek origins. And my anatomy lecturer was Italian, and he'd often interpret the Latin names for us, which I found helpful. And then he would describe a lot of muscles using food analogies, saying things like, "This is," as I use my fake Italian accent, "this is the bacon, this is the porterhouse," and those strategies they would be very helpful for me to learn and to remember what those landmarks were. So, how is it that you go about trying to instill the love and that anatomical knowledge to your students?
Yeah, so I normally like to take baby steps. One of the things I like to do is that trying to get the students or the therapists to find their learning styles. So there's a few different ways that you can do that. I'd like to use one that's called your visual, auditory, reading, listen, and kinesthetic. What I found is that the majority of the massage therapists, they are either visual or kinesthetics. That's why they choose their profession. So I tend to get them to find out what their learning styles, and then start slowly breaking down into parts, and also going back to those materials and recapping it, and even breaking down into small parts. Like, don't try to learn all the muscles. Maybe let's pick a particular joint and say we're gonna learn the flexors and extensors. Then I'll come back and revise it. One of the things that I normally do that when I'm teaching as well, I tend to make a lot of associations. So I'd say I'll break it down. Okay, let's have a look at which muscles originated or attached to the greater tubercle of the humerus, which muscles attach to the lesser tubercle of the humerus. Then which muscles originated from the ACEs, which muscles originated from the IIS. So kind of breaking it down, because that way, by making those associations, you can cover a lot of muscles. And I would say before we get into muscles as well, we need to make sure that we understand our body landmarks, and also doing a little bit of surface anatomy. I found some of the therapies or colleges, they don't go much about the surface anatomy. So it's all truly, you learn all the bone landmarks, but if you don't know how to palpate those bone landmarks on a client or client's body, that all the knowledge, it's not really applicable. So that's fun. And then lastly, once you go through that step, I'll normally say, try to explain to someone. Could be your partner, could be your the friend that you're studying with, or even tell your client. When your client say, "Oh, it's a bit sore here," so that's your opportunity to say, "You know what? Now it's my turn to shine." So, you know what? That's muscle you're working on. It's your gluteus maximus, which is starting from that particular position and finishes here. So when you do that particular action, that's when the muscle turns on. That's why it is sore. So you're not showing off to your client, but what you're actually doing, you're repeating yourself of those muscle knowledge. Because for any new knowledge, you need to repeat at least 30 times for that information to it. And I remember one thing when I was studying English as well, that one of my lecturers said, look, you really are learning English when you start dreaming in English. And when you study your anatomy, what happened is that at some stage, you're going to be dreaming of those muscles or insertions. That's a good indication that actually that knowledge it is finally sinking in.
So dreaming in Latin.
There's worse things to dream in.
Very true.
So there are a good deal of massage therapists out there whose anatomical understanding and reasoning probably sits at the lesser end. And that's not to talk them down as therapists at all. But if they're struggling to learn, or maybe they want to increase their anatomical knowledge, where do you think they should be starting, Raf?
So I'd say good start to find their learning styles. So let's say let's just say most of them are visual. So now with technology, there's a lot of different things that you can do in terms of really visual ones. So there's a few YouTube videos that you can watch. They are really accessible apps, anatomy apps that you can download on your phone. There are some other apps that you may have to invest a little bit more, but they give you that really nice 3D, 4D view. There are some even apps that you can actually have the AR mode. So pretty similar to you just have that visual of that muscle in your phone or on your screen. Then if you want to even to invest a little bit more, there are some awesome virtual reality apps as well that you can do. So I just get too excited about it. I've been spending hours and hours and hours with my virtual reality glasses now, and doing some awesome recording and looking to all different muscles and all different anatomy areas. So again, just depending. So for those ones, for the visual ones, that's probably, I would say, that would be a good way to start. Have to say that also, if you are interested to go a little bit more on that as well. So I do have a few webinar recordings that I've done in the last couple of years with ATMS. And also I have a couple of upcoming webinars with MMA.
So in April on the Gold Coast, you can join Raf for, is it side lying techniques that you're doing in that one?
Yeah, so that one I'm doing with sideline. On a note with like that self-care, found that with that lifespan of a massage therapist and working with a few different athletes. So especially in Sydney, I did a lot of rugby players, and I say I can't physically continue accessing, let's say, your adductors in supine. So I start looking to a few different ways that I can access some of those difficult muscles without put too much strength into my body. So that one sideline technique is pretty much showing some of those alternative techniques, not only sideline for pregnancy, which probably most of us are pretty comfortable with or understand, but also showing some different ways that you can access some of the muscles, like your adductors, your QLs, and even your upper traps and levator scap. And now, because again, really enjoy my anatomy, I always do a little bit of anatomy revision on those courses as well.
Side lying is such an underutilized position. I think a lot of massage therapists think it's just for pregnancy, but it can be so good for anything in the hip region, anything. And like if you really want to get in and get in around the shoulder, that rotator cuff, it's so good, so easy to do in that position.
I think a lot of therapists are just scared of moving their clients. Like massage is only done with someone laying facing down or facing up.
Yeah.
But why shouldn't we put them into the best possible position for the best possible outcome?
Yeah. I love side lying. It's so good.
Yeah, I normally find that always say I don't care about the client. I mean, in a sense that I'll get them moving around. I do techniques and do things that are comfortable for myself because I want to be in the industry for long. And that's why probably I'm here. I've been working for 15 years now on that industry. Otherwise, if I would say do some like requests of some of the clients, probably I will not be working still.
Let's go back to the beginning, Raf. How did you find yourself falling into the massage industry?
I probably need to go back a little bit. So again, I've been involved all my teenage as with all the sports, all different football, soccer, like I like to call it, volleyball, tennis, and I have a few injuries. I originally want to be a physio, but I did some of, I guess, was not able to get into physio. I started getting into physical education and personal training. Then I start working with doing some sports massage, and that's probably how I went into massage. So when I came to Australia, I done a little bit of English, and then said, look, I don't want to be studying just to keep my visa, but I want to study something that I can make a career out of it. So that's when I did my first, I guess, my remedial course in Australia, but I had a little bit of experience of muscle therapy back in Brazil as well.
And who did you train with for your diploma?
So I did it in Sydney. I used to be called Australian Institute of, Australasian College of Natural Therapy, which I believe now they went into higher education now. It may be Torrens University now, maybe part of the Think education.
Yeah.
So did that in Sydney like 2008, I think.
Okay.
Yeah.
And then when did you come here?
Moved to Adelaide 9 years ago. So just was a bit more family friendly. So my son was turning 1, and then it was getting really hard to do. So
if we go back through the archives, you've got a couple of ATMS webinars as well. One from 2023 with frozen shoulder, and 2022 where you, I think it was lectured on advanced anatomy. Can you tell us a bit more about those classes?
Yeah, so probably those ones are some of those. I have done a couple more. So probably I first started with one more with just some tips and tricks to learn anatomy, which again, I use some of those associations and things like that. Then I had one on origin insertions of lower body, and one of origin insertions of the upper body. Then from the feedback of it, they will ask to do some more muscles. So let's do some advanced anatomy revision, which we're able to cover some more muscles. And from feedback of it, is look, really wanted to specialize in particular area. So we done one on the pelvic girdle and one of the shoulder girdle. And from feedback, was a lot of questions about how to treat some of the conditions. So that's why I had one on some anatomy and techniques or guidelines how to treat sciatica, and that one how to treat the frozen shoulder. So it's kind of probably a line of thoughts, and from feedback we just come up with different ones.
We will pop links to those seminars in the show notes so that our listeners can access them with some ease.
That sounds like a lot, actually. That's quite a lot. You teach a lot.
I'm just trying to get a bit of time away from the family.
Yeah. The truth
just
comes
have
out.
some
That's
rest.
not even true.
Yeah, so those ones are recordings from ATMS, but I have a couple for coming up with MMA. So those advanced muscle anatomy revision. Actually, I'm doing that with MMA as well, but I'm dividing that into parts. Part 1 for lower body muscles, and then part 2 of the upper body. That's coming up in May and June.
Awesome. That sounds really good. And we will definitely add links to the show notes.
For our listeners who aren't from Australia, there's about 27% of you who are from overseas. MMA is the Massage and Myotherapy Australia, one of the professional associations. I think the largest of the professional associations for massage therapists in Australia. How long have you been with ATMS for, Raf?
I've been with ATMS for 15 years. So yeah, I think I'm what they call a fellow of ATMS now. So if you are more than 10 years, you qualify to be a fellow of ATMS. So I've been with them since the beginning.
Now, I know you are a bit of a fan of wet labs as well, because you've asked me to go to some wet labs over I think last year, and I politely declined. But you tell us if how you think wet labs can be beneficial? Because I know you do take your students to wet labs as well.
Yeah, so we quite frankly, we try to organize a wet lab with our local unit. So we find that's really good for the students. So pretty much to especially I would say for them to see the muscle layers, because we talk about it. We see like the pictures of how some muscles are superficial, how muscles are deep, but they are actually, when you actually work and see the specimen, you actually open your mind a little bit more. You kind of, when you have a look at the specimen and stuff, for example, you say, now, am I really able to release the hip flexors, for instance, or psoas major, for instance? When you have a look, you're peeling all the layers, kind of, do we really have enough strength to go through our time to actually go and work through the psoas major? So kind of have that visual of if you pass the barrier of seeing dead body, but when you have a look at the specimen, you're actually seeing those layers, pretty much peeling off those layers from superficial into the deep muscles. It gives you really good understanding.
It's easy to think that there's just skin and then some fascia and then muscle and then another layer of muscles, but there's so much more to it than that, isn't there? And I think sometimes body workers forget that a little bit. Yeah,
so I find that it's really like it's an opening eye when you kind of see that, if you're comfortable, of course, with that, and then you able to see kind of you understand a little bit more, and it create a bit more clinical reasoning for you as well when you treat your client.
Now you mentioned something a little bit controversial there before, Raf, and that's the P word, which some people think is the S word, the psoas. And why do you think there is so much fascination with the psoas?
I guess it's like maybe it's with the clients itself. And now they all come to you and say, "Can you please release my hip flexors?" They always, because someone done to me, can you do my hip flexors? And I say, yeah, that's not a problem. I can do your hip flexors for your placebo, but beforehand, I'm gonna work to the other hip flexors. Because again, you need to remember that we got 5 hip flexors, not only psoas major. And then you see a client saying, "Can you release my hip flexors?" They'll go and pointing to your psoas major. So I say, yeah, that's okay. Again, and they'll say, "Oh, that's the same for ITB." Mm-hmm. So the client come and say, "Can you please mesh my ITB?"
Yep.
And say, "Yes, I can for your placebo." So you feel better about it. But before that, I'm gonna work to the muscles that attach into the band. So making sure they work through the TFL first and glutamax first.
Yes.
As soon as you said ITB, my eyes rolled.
I came from one of those schools that love to get their fingers into the abdominal cavity and push down and then stroke what we thought was the psoas. And yes, you can palpate and feel the effect on the muscle, but jeepers, it hurt. And I often wondered what was the actual effect, other than when they finally took their fingers away and the relief, the relief that it stopped. So what do you feel is the bread and butter for massage therapists, Raf?
And probably I'll get a little bit controversial there as well. I think I've posted some of the socials, what the type of things that you don't, or some misconception. So from day one, I tell my students, stop calling masseuse.
Yes.
And say, look, please, you are here investing your money and your time to qualify yourself or get accredited. So please start. If you want to do your Set 4, it's fine, but please call your massage therapist. If you're doing your diploma, call yourself as a remedial massage therapist, or if you're doing your myotherapy, call your myotherapist. And for you to be able to claim that differentiated between someone that just do like a weekend course, you need to know your stuff. And knowing your stuff is starting by what you're massaging, muscles. So or any soft tissue. So you need to understand your knowing your stuff and understand the soft tissue, in particular your muscles.
I got called a masseur the other day.
Have you had a gender change there, Jackie?
Yes. Look, generally it doesn't really bother me too much because people say it and they seem to be just ignorant of what it actually means, and they don't mean it in a negative way. But I just laugh. I just internally laugh. I'm like, okay. I find it amusing.
Yeah. Now I just found that now if that comes from the therapist, it really hurts me, because look, I know that like the clientele, they don't know better. Then it's up to us to start educating our client. And I'll say, coming with the education as well, is that how clients talk about or wanted that 60 minutes massage, and say it's not a 60-minute massage, it's a 60-minute treatment, which all your assessment and things like that is part of your treatment. So you're not expected to come in to see me and you expect it to be 60 minutes on a table. So because so you're going to have a 60-minute treatment. So the assessment is quite important as well to understand why you're hurting and which muscles are going to have to address as well. So I can provide a therapy using the massage. That's why I find it's really important for the students or for the therapists to use the right terminology, and if we can, educating our clients about it as well.
So, Rav, what are some of the apps that you are using to geek out on learning anatomy?
Yeah, so the first one, actually, it's a web browser that it's free. So you can go into www.getbodysmart.com, and which I believe it is affiliated with KnHub, which there's a lot of videos on anatomy.
There's a lot of stuff on KnHub. I've looked on that one, yeah. And you can subscribe to KnHub. You don't have to, but you can, I think.
You can,
yeah.
But there are some free stuff online on YouTube.
Yeah.
So in terms of apps, you have one from, I think the company is called Real Bodywork, which they do have a few apps. Learning muscles, they have a trigger point one. They even have some videos about learning massage techniques. They even have some I think equine or even dog type of anatomy.
Oh wow.
Yeah, so there's a few things on that particular app that you can get, which I think the bundle is really reasonable as well. It's one off, and you pay maybe $10-12. It's really reasonable.
Oh, that's really good.
Then when you think in terms of more a subscription one, there are two main ones that I would say. You got your complete anatomy, and then you have another one called the Visible Body, which both of them, it's like a subscription mode now. The Visible Body one, you can even have like a web browser version as well that you can use. Both of those, they actually have the AR option.
And what kit are you using to view these things?
So all of those, again, I think you can have on your Android and then on the Apple iOS. Both of them you'll be able to access that. So again, you just need like internet, and you'll be able to do it. The visible for the AR option, you need the phone that probably it's a bit newer. iPads probably is not gonna work in terms of your AR option, but most of the new phones actually have the option of use the AR option. Yeah, so with the VR, I'd say probably the most common device is your Oculus Quest, and then there's a few apps that you can get, again, a subscription mode. That one probably requires a little bit more of an investment, but there is an Australian company based in Queensland. They call 3D Organon, that they have a really nice VR app that you can use. and they are probably comfortable that you can use with all different VR headsets. They have a few ones. They have some headsets, they are computer based. You have to use your computer, but there are some headsets, they are standalone. You don't need to use the computer.
So what would you say to the massage therapist that says that learning anatomy isn't important?
Yeah, I guess probably come back to what I was saying, for us to be calling ourselves a therapist. So we need to make sure that we really know our stuff. So it could be, again, as I said, you don't need to, remember all the muscles innervations and things like that, but at least the most common muscles, organs and insertions, and most importantly, how to palpate those muscles. Because in that way, you actually be able to perform or manipulate that soft tissue or that particular muscle.
I would say that unless you are super confident with your anatomy skills and your palpation, maybe it's a pretty good idea to redo some anatomy study, check out some of these apps. If you already know a lot of the origins and insertions and where everything is and how it all fits together, then it's only going to reaffirm that you already know this.
You're probably going to make you a better therapist.
It doesn't hurt to go over some of this stuff a couple of years later and reassess, relearn some things.
There's certainly some fantastic resources out there, particularly with YouTube being so accessible. Whether it's geeking out on the likes of Dr. Gunther's ER and the Heidelberg Institute of Plastination, or some of these video series like Strolling Under the Skin. And there really is no excuse not to learn, given how much information we have available in such wonderful formats.
And there is even games. If you like your games, you can actually learn by playing. There are apps that you do. I think it's called Speed Muscles or Speed Anatomy. They're actually you pretty much got a muscle that come up, and then you need a scroll bar on the side. You need to tap on the muscle as accurate and as quick as you do it, you can, so you can get more points. So pretty much you can even play games. So that's one other thing that I normally do with my students as well. So I do play some games. Could be, let's say, when you start learning some of those movements. So I would go and play games like Simon Says with your body movements, or go and do some online quizzes. After the workshops or after the lesson, let's recap that knowledge. Let's go and try to see how much you remember. And some of the online quizzes, you can even create like an assignment that you can play on a day, or you can send that to the students or anyone that you can try and see how much you can do, how much you remember. Other things, like if you really like your flashcards, to make your own flashcards, there are a particular flashcard that you can do yourself with all your photos and all that, and then you can scan that into your phone and pretty much play with some more like celebrity heads, and that's different way of doing it, using just like that gamification. So there are even games that probably some of the high school students or school students use, like the Kahoot. So I created multiple Kahoot games, and like I play with my students. I use that on my webinars to get just the audience a little more engaged. And I'm actually working some of the courses, a course on Kahoot, which you can share with people. So you can share like the slides, and then straight after you got quiz on it. So yeah, there's a few different ways that you certainly can, if you want to. There's some few different ways that you can learn.
The games sound pretty good to me.
We should play later on.
I think I will. I'll have to find one.
My crowning glorious moment of anatomy was being at a quiz night one night where there were 10 questions about anatomy. I'm sitting on this table with people who had no clue but decided that they knew the answers anyway. And it's like, oh, what do you call the bones in your fingers? And one goes, oh, they're called digits. Like, no, they're phalanges. No, never heard of the word. They're digits. So I think we need to put down the word phalanges. And then they asked, what is the indentation in between the furrow of the eyebrows? It's like, oh, I know this one. It's the glabella. It's the only time outside of the massage clinic that anatomical knowledge has benefited me.
And Dave, it's funny that you talk about quiz night. They actually, because I love that much with the gaming and stuff. For the Natural Medicine Week this year, I created an online event, which is a quiz night for the general population. Of course, massage therapists can be involved. It's a free event, so everyone can have their favorite beverage, sitting in front of the computer, and then we're just gonna do an online quiz to say, what do you know about massage therapy? And we're gonna be asked a couple of questions, see how much of the general population will know about it, and probably just give a brief explanation what massage therapy is. So that would be good as well.
So that quiz night is on Friday, the 24th of May. Quiz night, what do you know about massage therapy? Look for it in Eventbrite.
Is that after conference? It is, right?
It is. It's a week after.
Okay, I can go. That is really cool. That's exciting.
You know what? I may even have some guests.
Yes.
To help me with that.
I think there are going to be some celebrities there.
Yes.
So if you were to meet a student today, Raf, one that's not your own, what would be the best tip that you have for that massage therapy student?
So I would say if you want to be like a better therapist, really to start with, going to be really important to invest your time into try to understand the muscle, the body itself, and in particular the muscles, because it is fascinating. Once you start it, you get excited about it. You can't go back. So that probably I would say try to understand the body systems and muscles in particular, and then find some of those strategies that works best.
And we know that the average lifespan of a massage therapist is somewhere the vicinity of 5 to 7 years. It's around 5 years for male therapists, about 7 years for females. What are the tips that you would want them to take away for having a long and happy and rewarding career?
Yeah, so I'd say probably self-care is so important. I know you guys emphasize that so many times in your few different episodes. That's how important. I'm lucky enough to work at the college, so I can get massage from the students. So I actually have probably one massage per week. So I'm really helpful with that. And making sure also probably understand you're limited. How many massages can you do per week? Can you afford to take some time off? So normally, so before kids, I used to work for 3 months and have 1 week off. 3 months and 1 week off. So I was making sure that I was taking a lot of breaks, making sure self-care, it's really important. And then know your limits, how much you can do, what type of techniques are you applying, does that feel right on your body? And as I said before, if the client asks for a particular technique and that it doesn't sound right, don't feel comfortable for you, just say, I'm sorry, I can't do that technique, but I can still work through those muscles in a different way, which is more comfortable for my body. Because at the end of the day, I want to provide the same quality of service for my first client to my last client. If I don't look after myself, and then if I don't do my techniques properly, looking after my body, I won't be able to provide that.
That is such great advice. Honestly, that is such great advice. I think knowing your limits is probably one of the hardest things as a therapist when you first start, because you just want to give all the massage to everyone and you're so excited and you want to get your career going. And then all of a sudden your body aches because you've worked too much too quickly. And then you don't know what to do about it. So absolutely knowing your limits and building up slowly when you first start, so important.
Well, if you like what we are doing here on the Folding Towels podcast, why not leave us a rating or a review, particularly if you're listening on Apple Podcasts or through Spotify. It'll help us to be found by more massage therapists just like yourselves. And don't forget to hit that like or subscribe button in your favorite podcasting app. Raf, it has been a pleasure having you on the show with us today.
Thanks, guys. It was my pleasure to be here with you guys. Thanks very much for the opportunity.
So look out for Raf on the Gold Coast in April 2024. And also join us, check out the link in the show notes to Eventbrite for May the 24th and the anatomical quiz night.
I'm super excited for that.
I hope you see you guys there then.
Fantastic. Thanks for joining us, and we'll see you in the next one.
Thanks, everybody. Thanks, Raf. Bye.
Thank you. Bye.